Hi guys, it's Nicole from the Physio crew, and I'm doing you a quick video on my dog walk this evening to tell you all about the importance of laughter in recovery. Now, today I woke up and I was in one of those little bit of a bad mood, and I tried to think about trying to bring myself out of that mood and feel happy. So on the way up to Bristol, I was just thinking about it, and it was quite easy to thinking of what I had to do in the day to kind of elevate my mood up and feel a little bit more positive. And then I wanted you guys to really think about the importance of laughter in recovery, because what I was trying to do today with the patient is, yes, we take physio really seriously and making sure that we're doing all the treatments accurately, doing a diagnosis accurately, doing hands-on treatment, but also to look at things a little bit more holistically and to think about the importance of sleep. For example, I did a talk yesterday or Wednesday, yeah, it was yesterday, God, it feels like ages ago, on sleep, the importance of sleep, thinking about the importance of touch. For example, in ITU, there was a particular lady today who I was basically talking about liking salads, and then I said I really like tomatoes, they're my favourite vegetable, and she was joking around because obviously tomatoes are a fruit, which I'd forgotten about. But we're having a laugh about that and thinking about trying to, if you have a loved one or someone who's recovering, particularly if they're elderly, they might have had life-changing injury, they may have had a hip fracture, they may be experiencing pain following a total knee replacement. Try and make sure that you're putting that person in an environment where they're getting out of that normal realms of just being absorbed by pain and immobility and negative thoughts, and try and take them and create an environment for them which is relaxing, help them to create a optimal sleep environment, try to help them laugh and encourage them, because there's lots of scientific evidence to show how that can help people, and you can help just by creating an environment which is optimal for healing and encouraging them to move. Obviously with the advice of a professional, because all of the different injuries are completely different, all of the surgeries are completely different, but in most things we want to try and get people's heart rates up, we want to try and get them moving so that we prevent the risk of having like a deep vein thrombosis, so we want to try and encourage that. And this particular lady, I find her really interesting because she, I won't share the details, but she's had, I'm sure she wouldn't mind actually, she's had an aneurysm, and that has affected her. I mean, her brain is completely normal, she's completely as you and I are, but she has problems sort of with tonal changes in her hands, tonal changes in her legs, so we always have a bit of a joke and a giggle because she really struggles when she's in an upright position to bend her knee. And these are the struggles that we just forget, like if we're athletes or something, some of these big injuries and illnesses and diseases and conditions that we can get, they're life-changing, and it really makes you grateful when you meet these people. But I was talking to her about her stay in ITU because I'm really interested in sleep at the moment, listening to this book. I've finished that book now, but I'm looking into a few research articles to have a little look how specifically it applies to patients. And ITU is one of those places, so ITU is intensive care, and you normally go there if you've had a very serious incident or perhaps following a trauma, and it's a very hostile environment, like you're having tests done all the time. It can be very scary, and quite often the staff won't know your level of consciousness. So quite often people will look like they're asleep when they're in an induced coma. So an induced coma is where they use medication to keep you asleep so that they can keep a tube down your throat, down your trachea, so that it can have oxygen in and out, and they can help to ventilate you. And physio's role in that instance would be checking blood gases, putting tubes down in to suction the chest. But it's really important that if you have a loved one who is in that situation, make sure when you go in that you're talking to them, because as if they're there, completely present, because sometimes they are. And this particular lady was telling me, how she could hear what they were saying, and it's so important that if your loved one is in that position, that that you're reassuring them. There's lots of clinical evidence that if you touch their skin, that can help with healing, because in an ITU environment, it's very what's the word, clinical, and actually they've done evidence for people touching the skin, and that can help, yeah, definitely with healing and to make the person feel better, and then talk to them as if they're there. It's kind of weird. I remember when I was working at Derriford, it's kind of weird to be like, hi Mr. X, how are you today? are you happy for me to do this, and asking permission, particularly if you're a physio. We're all trained to do that anyway, but if you are a loved one, to say, oh, you know, we're going to be doing this today, I'm going to play you this music today, because they can sometimes hear it. So that's important to do, and yeah, to bring laughter in. So that's the importance of laughing. That's just a little top tip and fact for you to know, that if you have got a loved one who's in ITU, make sure that you're talking to them normally. Don't just assume that because they're asleep they can't hear you, because often they can. Alright guys, I think that's probably it for tonight. Take care, have a good night, bye bye.